It's very exciting when I think about our annual report and how it's really anchored by our strategic plan. Our strategic plan has 5 pillars. The first one is around patient engagement. If we don't actively engage our patients, really understand their preferences, understand how we can help navigate them to optimum wellness, what a huge missed opportunity. And again, patient-centered care is the center of all we do. We couldn't do what we're doing without our workforce, which is really our most valuable asset. As we've invested over the years to make sure that not only we have an engaged patient, but we also actively engage our workforce. So we've invested a lot in really making sure, how do we become this place where people want to stay, they want to engage, and again, they're able to make the impact in vulnerable communities. When I started at Access 25 years ago, we had very selective nursing roles. And we really weren't that good in really defining how nurses could really make an impact on the healthcare outcomes. And we've had a lot of learnings along the way. And I must say, as we were able to look at the Affordable Care Act and the benefits of that, getting more and more people engaged in their health, but also we had a lot of our patients who had a lot of chronic disease and they required navigation. Not just navigation from getting from point A to B, but also a lot more hand-holding and having professionals that not only understood care, but they also understood how to really motivate and pace people and patients and families to how they can get to their care needs. There's something that nurses have that's instinctual, that, with those instincts, they can understand without many times the patient even saying what the issue is. I recently talked to one of our new care coordinators, and I'm happy because I think we've got about 80 now in our health system, having to help our patients that really are high risk and moderate risk with their health conditions. But I was talking to one of the care coordinators and I said, what gets you excited about working at Access? She really just paused a second and she said, the impact I'm making. And I said, tell me more. And she said, well, I have a patient who for years has refused to have a mammogram. And we know, especially in patients of color, the chances of cancer, and especially cancer being diagnosed late stage. But she said, as she was educating the patient about the need for screening, she said, what if I would go with you to the mammography screening? And she said the patient got silent for a second and then said, you know what? If you go with me, I'll go. That's why I get so excited every day, even after 25 years, when I hear stories like that. And I know that beyond this story, there's so many more of how we're touching patients and families and communities by sometimes just simple acts, but they're huge with impact. I also think about our financial future. Historically, for community health centers, it's really been based on a fee-for-service model. Basically, patients would come in, they would get serviced, and then whatever they did after 5 o'clock, almost good luck, God bless. Post the Affordable Care Act, where there was a lot more discussion around impact and providers really being responsible for making sure that they not only saw patients, but they also had skin in the game around health outcomes. And so with managed care and the expansion of managed care, conversations around value-based care came into play. And this is an interesting term because on the insurance side, it really is about payment and what they're going to pay for as far as outcomes. From a patient perspective, when we talk about value-based care, we really have to peel the onion a little bit more, because what might be of value might be something like a bus card or the ability to get in at a time when it's most convenient for the patient, or to really make sure that patients don't couch surf or that an immediate need is met. And so as a community health center, we really have to pay attention to how we're going to get reimbursed based on value-based, and understand that we're really now on the hook for patient outcomes. But at the same time, we have to be smart and understanding that for our patients, there's a lot of things that get in the way. As we navigate our patients, it's important that they see us as true partners, one in which their healthcare needs and how they are used to navigating, but what we can do to be able to support them. What's also interesting is that for a lot of our patients, it has nothing to do with that they would prefer to go into an emergency department. It has more to do with social determinants. Whether there's a lack of transportation, whether there's food insecurity or housing insecurity that drives them into those most expensive portals of care. I also think about strategic partnerships. In the last few years, we've strengthened those partnerships, whether it's anchored through dual ways that we connect through our technology, through partnerships in which we've taken the best of our partners and they've taken the best of us, and we've integrated it in a way that will have a seamless impact for our patients. And lastly, leadership in community health. It's important for us to be a leader in community health, and this is probably one of our most valuable pillars. As a community health center network where we see over 180,000 individuals every day who consider us their healthcare home, we know that being an advocate for health equity, understanding what practices will have the biggest impact on health outcomes, we want to be that strong voice. You know, I often say that for many of our patients, they're invisible and they don't have a voice. Well, through our role in leadership in community and on the various communities that we're in, we really put a stake in the ground. We really stand for how are we going to really make sure that issues around health equity, issues around disparities, and most of all, the evidence that we can look at that will give us the best practices and ways to impact the most vulnerable should really be our hallmark as a community health center.